So hello and welcome to our Ontario Network of CAPC and CPNP projects webinar. We have a really special webinar for you today. And the title of the webinar is Social Determinants and Inequities in Health for Black Canadians. And it's about the Mental Health of Black Canadian Fund. So, sorry, I just have one more thing here to do. Okay. And I'm really excited to have our special guests here, Dolon and Ifrah. But before I introduce them and hand things over to them, I just wanted to take a moment to pause and offer acknowledgements and thanks on behalf of our network, which is sort of over a big area of land, all of Ontario. We want to acknowledge the First Peoples of the territories where we work and serve families, and just offer such deep gratitude for being able to do the work that we do in communities. And I myself am saying hello from lands that are the traditional home of the Haudenosaunee and Anishinaabe peoples. I want to acknowledge that, and also acknowledge that there are others here that are participating from different territories. So with that, I would like to again welcome Dolon and Ifrah, who have agreed to come and spend some time with us. And I also want to point out that we do have closed captioning. Oh my goodness, we might not have closed captioning today. For some reason, let's see. No, I apologize. I don't have the closed captioning set up. So forget I said that. And now I will just say hello to Dolon and Ifrah, and I welcome you to introduce yourself. And we look forward to what you're going to share with us. Invite everybody to put their comments or questions in the chat, and I will monitor that for our presenters. So with that, I'm going to hop off camera, but as you know, I'm here, and just reach out if you need me. Over to you.
Great, thank you, Sydney. So I will get us started by sharing my screen. There we go. Hello, everyone. Thank you for having us this afternoon. My name is Ifrah Abdillahi. I'm a policy analyst in the Mental Health of Black Canadians program in the Social Determinants of Health division. I myself am speaking today from the traditional lands of the unceded territory of the Algonquin and Anishinaabe people. I also wanted to take a moment to say Ramadan Kareem to those who are observing the month of Ramadan. Before we move on to talk about the context of the report that we're presenting today, I wanted to begin by defining some of the terms that will be used throughout the presentation. So the first term is health inequalities, which refers to the differences in health status between groups in society. These differences can be due to biological factors, individual choices, or by chance. But public health evidence suggests that many health inequalities are attributable to unequal distributions in the social and economic factors that influence health, for example, income, education, employment, and social supports. Those factors are often referred to as the social determinants of health. Inequalities in these conditions can lead to inequalities in health. The report we present is focused on inequities in health, or systemic, unfair, avoidable social, economic, and political factors that contribute to unequal health outcomes. These are the unjust differences that can be eliminated or reduced by collective action and the right mix of public policies. In other words, health inequities are not simply numerical differences between the health outcomes of different groups. Next is the use of the terms race and ethnicity.
Sorry, Ifrah, I'm just going to interrupt you for 1 second. Do you want to advance the slides?
Yes, sorry.
Yeah.
I need to multitask. Okay. Okay. Here we go. There we go. So next is the use of the terms race and ethnicity, which are distinct. Race is a social construct used to categorize people based on perceived physical differences, for example, skin color, facial features, and others. There is no genetic or biological basis for race. And an important rationale for collecting race-based data is to identify, monitor, address the inequities that stem from racism and bias. Ethnicity, on the other hand, is a multi-dimensional social construct that refers to a sense of group belonging based on shared characteristics such as geographic origin, cultural traditions, language, and religion. Overall, there is a need to standardize definitions for comparability across data sets. In the report, we frame anti-Black racism as a determinant of health. Discrimination against Black people is deeply entrenched and normalized in Canadian institutions, policies, and practices, and is often invisible to those who do not feel its effects. This form of discrimination has a long history, uniquely rooted in European colonization of Africa and the legacy of the transatlantic slave trade. There is no singular Black identity. Black Canadians are made up of diverse communities representing a complex web of different histories. To give a bit of background on the context of the report, I want to tell you a bit more about the Mental Health of Black Canadians initiative or fund. In 2018, the federal budget committed $10 million over 5 years to develop research in support of culturally focused mental health projects for the Black Canadian community. In 2018, the Public Health Agency of Canada launched the Promoting Health Equity Mental Health of Black Canadians Fund, which is part of the larger federal response to addressing barriers to mental health in Black Canadians. To date, the fund supports 16 projects that have been funded through 2 streams of funding, an incubation and an implementation stream. While current projects address a range of contexts and audiences, each of them is investing in Black communities to advance health equity and build capacity for interventions that are effective and culturally focused. In addition, all projects are informed by and integrate a focus on anti-Black racism as a key social determinant of health and mental health. The fund also serves as a knowledge mobilization function by enabling broader Black Canadian communities in the exchange and dissemination of knowledge generated by the interventions in order to build momentum for sustained gains throughout the initiative. There are 3 key pillars to the Mental Health of Black Canadians initiative. These are outlined here as investing in community, strengthening data and evidence, and knowledge mobilization. Each of these contribute to promoting health equity and addressing mental health and its determinants for diverse Black communities across Canada. The fund is also anchored in these key principles. Anti-Black racism is the overarching principle of the fund, as it is the key social determinant of health that underlies health, including mental health, and inequities faced by Black communities. In the area of leadership by Black Canadians, projects are delivered in and are of primary benefit to Black Canadian community members. Projects are anchored in meaningful data and evidence. Projects also address one or more social determinants of mental health for Black Canadians, such as anti-Black racism, education, policing, criminal justice system, poverty, and social exclusion. Projects consider and address unfair and unavoidable differences in these determinants, their health outcomes, and reach an impact of interventions for various subgroups within the diverse Black Canadian community. Projects also recognize and challenge unequal power relations. Through leadership of Black communities in Canada, the fund is working towards increasing community capacity to address barriers to mental health by increasing understanding of these barriers, as well as knowledge of effective, culturally focused approaches and programs to address these barriers. While not a stated objective of the fund, building our agency and the broader Government of Canada's capacity to design and implement equity-focused upstream grants and contributions programs in partnership with communities, what we refer to as capacity bridging, and working across sectors to address the social determinants of health have emerged as important objectives. The work of MHBC is in close collaboration with our external working group, which is made up of 11 experts that reflect mental health practitioners, researchers, and those with lived experience. The key contributions of the working group include supporting our funding review process, capacity building, providing capacity building and knowledge mobilization, and strengthening and supporting in our strengthening evidence activities. They also ensure that community organizations are equitably considered compared to academic or larger organizations. Given that this is the only investment of its kind for Black communities, building and bridging community capacity were as important as quantitative and traditional methods. In our discussion here today, I want to also connect MHBC to another momentous policy action taken by the Government of Canada in 2018, which was the recognition of the United Nations International Decade for People of African Descent. Within the three themes of the decade, which are recognition, justice, and development, our work through MHBC, particularly as it relates to data and evidence, is surrounded around one sub-theme, which is recognition. That is information sharing, which directs states to collect, compile, analyze, disseminate, and publish reliable statistical data at the national and local levels, and that this statistical data should be collected to monitor the situation of people of African descent, assess progress made, increase their visibility, and identify social gaps. The directive spelled out through the sub-theme of the decade links very well to the evidence building portion of the MHBC fund, which aims to strengthen the data and evidence on racial discrimination, mental health, and the determinants of health through multiple activities, including mapping the national and international sources of population data currently available on racial inequalities in health and its determinants and methodological approaches, undertaking new analysis of existing data, producing knowledge products on the drivers of health, and producing knowledge products on the drivers of health inequalities. In the area of mapping, we are working with Dr. Arjuman Siddiqui, who is the Canada Research Chair on Population Health, Equity, and her team at the Dolon School of Public Health at the University of Toronto, who lead our Equity Data Methods Mapping project. EDMM is a 2-year project currently in phase 1, which includes a scan of dominant data sets within Canada, the US, the UK, and New Zealand, as well as a scoping review and expert consultation with prominent scholars on racial health inequities to ask their thoughts on the data that they use for their research. Finding from phase 1 will be used to inform the production of new analysis in phase 2. Within the pillar, our data analysis, we have begun using knowledge products that provide preliminary insights into the determinants of health and mental health illness hospitalization, with a focus on inequalities in schizophrenia hospitalization rates for Black Canadians. This work is in its early phase of scoping. In relation to the media reporting, in the early months of the pandemic, and more intensely over the course of last summer, we followed closely the national developments around the collection of race-based data across regional health authorities and provided bi-weekly updates to the Office of the Chief Public Health Officer. Some highlights from these developments include data collection guidance issued by CIHI, the Canadian Institute of Health Information, as well as recommendations by the Upstream Lab and the Ontario Anti-Racism Secretariat's Race Data Standards. For our knowledge products, we commission evidence reviews, and one example of that, it was presented at our event that we held for this year's Black History Month, where Dr. Julian Hasford from the University of Ryerson presented a review of evidence of what works to promote mental health among African, Caribbean, and Black Canadians through actions on institutional discrimination in the education, legal, and child welfare system. Lastly, to recap the work that we're doing, we are currently in the process of scoping a proposal to have a special issue of PHAC's Health Promotion and Chronic Disease Prevention journal focus on health outcomes, particularly related to Black Canadians. I will pause there and turn it over to Dolon. Thank you.
Hi, everybody. Good afternoon. My name is Dolon Chakravartty, and I'm a research analyst with the Public Health Capacity and Knowledge Management Unit at PHAC's Ontario Regional Office. I'm speaking to you from what is known as Toronto, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis people. So Ifrah, maybe we could switch and I could start sharing my screen. Let's see. Yeah, one sec. Okay. Does that work for everybody?
Dolon, we see it. You're not in present mode, but we see, oh, there you go. Yep.
Is that okay?
That's good. Yes, we see.
Okay. Okay, so the first slide should say, kind of present a blue square with social determinants. Does everybody see that? Okay, great. Okay, so as Ifrah mentioned, today I'll be discussing one of the knowledge products that was generated by the Social Determinants of Health Division. And actually, Ifrah is one of the authors of this report, so I feel lucky to present her work, which is excellent. So this snapshot was released last September, September 2020. And as you can see, it's called Social Determinants and Inequities in Health for Black Canadians. The snapshot kind of presents highlights and key kind of background for how anti-Black racism and systemic discrimination affect health outcomes and inequities for Black Canadians. Okay. So the data sources that were used in the production of this report primarily stemmed from PHAC's Health Inequalities Data Tool. So this is an interactive resource for understanding the magnitude and reach of health inequalities and social determinants of health among diverse groups of Canadians. So I'm not sure if members of this audience are familiar with this tool, but it is publicly available and you can analyze kind of different health outcomes and different variables. This tool was developed to support programs and policies at national and PT levels to understand and to better meet the needs of diverse Canadians and to contribute to the reduction of health inequalities in Canada. The data that are kind of make up the tool are derived from multiple cycles of the Canadian Community Health Survey, which are then supplemented by data from the 2016 census and different research literature. For the purposes of this report, Black populations are defined as those who responded Black in these survey products and not necessarily mixed race populations. And most inequalities were measured in relation to Canada's most privileged population, who are white Canadians. So the report starts by discussing the kind of multiple levels of health and social inequalities that are linked to discrimination. So first of all, discrimination at the individual and interpersonal levels, including overt and covert racism, slurs, microaggressions, as well as looking at institutional discrimination. So the kind of tendency of racial profiling in police forces, over-policing of racialized individuals, particularly Black communities, use of excessive force and harassment, as well as societal discrimination, so overrepresentation of Black individuals in both criminal justice and child welfare systems. And how we kind of think about these aspects of discrimination and racism, what are the impacts, including chronic stress, trauma across generations, reduced access to social and material resources that affect communities over time. So in terms of looking at institutional discrimination, the report considered 3 domains of education, employment, and housing. So when we look at education, we can see that for Black Canadian students, there are opportunity and achievement gaps, streaming into more non-academic fields. So for instance, Black high school students are the most likely to be streamed into special ed and applied programs, and the least likely compared to their counterparts to enroll in college and university students. Black students in Toronto are more likely to be suspended from school than white students. Discrimination against Black youth is also linked to negative stereotypes and lower expectations from teachers and school staff. This is compounded by the lack of Black educator advocates and Black youth often having to lesson plans that are not necessarily relevant to the lives of Black Canadians, neglecting to acknowledge histories of Black Canadians, and this can ultimately lead to a disengagement from an academic sphere. In 2016, there were only 1.8% of Black elementary and high school teachers in Canada, leading to kind of a situation in education where you're not seeing yourself represented or understood by others who are similar to you. In terms of the domain of employment, many Black Canadians face discrimination in the hiring process. In a study of employer responses to resumes of similarly qualified candidates with African or Franco-Quebecois last names, the Franco-Quebecois candidate was called for an interview 38% more often than the African candidate. So we can see this in the workplace as a tendency towards kind of preserving sameness or the preservation of status quo, where underlying racism can lead to employers claiming a lack of fit as the rationale for not hiring or promoting skilled racialized candidates. Often this is reflected by overt and covert workplace racism, with 13% of Black Canadians reporting experiencing discrimination at work. Newcomers who are racialized often face additional issues. So newcomers who are Black face kind of additional discrimination due to language factors, speaking with accents, or perhaps difficulties in adapting to unfamiliar cultural norms, as well as a lack of recognition for previous education, work experience, and other credentials. In housing, the report identifies how Black Canadians have experienced exclusionary screening and financial barriers to renting, and especially kind of this discrimination spectrum, with those with darker skin tones experiencing greater levels of discrimination. So once we examine, all of these systemic and societal level effects of discrimination, we can see the compounding effects. So when we start with an inequity in a family income, this can lead to effects of job stability. It can affect housing, which can then affect academic performance and engagement in school. So all of this racial discrimination within different sectors and institutions reinforce and interact with one another, creating a cycle of effects across the lifespan and across generations, actually. The report looked at and highlighted national data on income and found that in 2011, Black Canadians were counted among the working poor more than twice as often as white Canadians. Black Canadians who are recent immigrants were 2.6 times more likely to be among the working poor than Canadian-born counterparts. So we can see that kind of the impacts of these institutional and systemic discrimination affects multiple sectors: income and employment, housing, food security, etc. So we all know that the causes of these inequalities are complex, but maybe we can, take this up in the discussion portion. We can reflect on how racism and discrimination may contribute to these inequalities and what might the implications be for the programs that you coordinate and deliver for health equity promotion, etc. In terms of housing, we see multiple kind of statistics reported here related to below standard housing. And so the definition of below standard housing is that housing costs exceed affordability, is very, very crowded, or requiring major repairs. So for these four measures that I've chosen to highlight here, we can see that Black Canadians are overrepresented in each of these domains compared to white Canadians. So both, in terms of crowded conditions, living in dwellings in need of major repairs, lack of affordability, or living generally in substandard housing. These data, again, are reflected in food insecurity. So adult Black Canadians reported severe or moderate food insecurity almost 3 times more often than white Canadians. And this is also mirrored in youth, age 12 to 17, who reported food insecurity 3 times more than white Canadian youth counterparts. The report then goes on to kind of examine some health and healthy behaviors. I won't go through all of these statistics, but some of them might be familiar to you. So prevalence of diabetes among Black Canadians is more than twice the rate than among white Canadians. Self-reported mental health is reported to be much poorer for Black Canadian communities, particularly among women. On the flip side, Black Canadians reported more overall positive health behaviors, including significantly lower rates of heavy alcohol use and smoking compared to white Canadians. So as this kind of summary report provided a basis, and it was actually the first evidence and review produced by PHAC examining subpopulation at this level. We know through the pandemic, and we have seen how COVID has amplified these existing social and health inequalities in Canada. So for Black Canadians in particular, legacies of historical and present day anti-Black racism underlie a broad range of socioeconomic inequities, which has impacted disproportionate risk of hospitalization for and mortality from COVID-19. So as we know, and I'm sure all of you are familiar with inequitable conditions that existed before COVID, but because of the pandemic, we've seen kind of differential exposure due to material circumstances, due to occupational factors, overcrowded housing conditions, differential susceptibility to infection based on pre-existing health conditions, age, other biological factors. And most upsetting perhaps is the differential treatment that individuals have received within the health system. So whether it's access to care, access to testing, access to appropriate language and treatment, quality of care related to stigma and discrimination, we've seen all of these things being exacerbated as a result of COVID. We've also seen that, public health measures that have been instituted, for instance, the insistence on working at home does not apply across the population equally. So for essential workers who we found out, through the course of this pandemic, especially in urban centers, are more largely racialized, including Black Canadians, we've seen greater numbers, greater deaths, greater impacts. Some jurisdictions have started collecting race-based data related to COVID cases. So what I'm showing you here is the City of Toronto Public Health has started collecting race-based data since May of last year. And they've just further demonstrated that the pandemic is disproportionately affecting and impacting already marginalized groups, including racialized communities, LGBTQ2+ Canadians, Canadians living with low income, disabilities, migrant workers, Indigenous populations. The graph shows the case rate of COVID per 100,000 by ethno-racial group. And this is data collected up to December 2020. You can see through this graph that racialized communities have been affected much more greatly with COVID. I've just highlighted how Black Canadians fared on this particular data point. In Ottawa, Ottawa Public Health released a report earlier this year examining racial identity in COVID. So in Ottawa, although only 7% of the population identifies as Black per the 2016 census, 37% of COVID positive cases were among Black individuals at the time of this data collection and report. I wanted to take a moment to just briefly describe the data landscape. So, COVID has really increased calls for the collection of race-based data across Canada. At the current moment, we do not have an exhaustive portrait on the health of Black Canadians or on racialized Canadians due to gaps in data. So historically in Canada, race-based data has not been collected in health and social surveys. So although we are seeing things change due to COVID, it's still emerging, and it depends on where you live. So for instance, race-based data is now being collected for COVID positive cases in Manitoba, Ontario, and Nova Scotia, but it varies widely by public health unit. And there's been multiple barriers in the collection of this data for various reasons. An additional problem is that data on intersecting identities is also rarely systematically collected. So data on sexual orientation, gender identity, immigration status, as well as other determinants of health are not routinely collected in multiple Canadian health and social surveys. For this particular report, we know that Black Canadians represent 3.5% of Canada's population, so approximately 1.2 million individuals. So, as with other racialized groups, Black Canadians represent a relatively small proportion of the Canadian population, and this presents challenges in analyzing and reporting on outcomes for small populations and subpopulations. So these challenges include a lack of ability to detect statistical differences between populations, as well as privacy concerns when reporting the data at national and sub-provincial levels, among others. Finally, the ways in which we measure health, conceptualize health, talk about health can be different from kind of a standard survey where we're measuring variables at a national level, which can vary widely with community knowledge and ways of knowing. I wanted to point this out because I'm sure many of you come across this in your work about, whose knowledge counts, how knowledge can be recognized or can be marginalized, and what are the different ways in which we can acknowledge and acknowledge and recognize different ways of knowing. So as I mentioned before, there is kind of an incomplete and inconsistent lack of data collection at the federal government level. So because of COVID, there's been more initiatives with academic institutions, research institutions, as well as private sector jumping in and trying to supplement this data collection. So there is a project called The Colors of COVID that was kind of initiated by the Federation of Black Canadians, partnering with a private sector organization who are doing a national scale research study seeking to understand how Black and other racialized communities are disproportionately being impacted by COVID due to race-based factors. There are also many other studies and reports that have been released in the past year on the primary and secondary impacts of the pandemic on racialized populations. So we can see, I've provided a couple of examples here. One is Statistics Canada, looking at kind of labor market analysis for Black Canadians during the pandemic. There's been multiple academic studies looking at, different factors, occupational factors, housing related factors, transportation factors, and how these have exacerbated the effects of COVID. And this will unfortunately last over time. So that's pretty much the report. We have provided some references for you if you wanted to look into things more, and we can open it up for questions if we're ready now. Thank you. Let me just stop sharing, sorry.
Well, thank you so much, Dolon and Ifrah, and yes, we invite people, if you have questions, feel free to either type them in the chat or let me give permission for you to unmute yourself. So you should be able to unmute yourself and feel free to do that if you want to ask a question of our two presenters. And as you're considering the comments or questions that you have, I just have a couple of things that I'd like to say. I thank you for the reminder about the health inequity tool. And as Blanca pointed out in the chat, we have had as a network some introduction to it a few years ago. So it's good to be reminded that it's there and to think about how we can be tapping into that important resource for sure.
I just wanted to mention, Sydney, that the data tool is being updated with more current data as well, and will eventually include some COVID data if that's of interest.
Absolutely, absolutely. Certainly, you talked about the need for consistent data across the province, and I know that that's something that's on our mind too in terms of our program evaluations and with the value that we have of our programs being very community-based, which is so important and responsive. One of the potential drawbacks of that is differences in terms of the information that we're collecting. And I wonder if you'd be willing just to speak again a little bit about, I think it was you, Ifrah, who talked about race versus it was ethnicity. Was it race versus ethnicity? And would you be willing to speak about that again a little bit and just give us something to ponder as when we're doing our collection and the work we do of information?
Yes, absolutely. So I guess in the work that you're doing, do you mean categorize, like capturing race versus ethnicity in the program evaluations, or?
So like intake forms then that we would use to gather our data of the demographics of the communities we work with. Is there sort of anything you can give us at least to think about when we're thinking about these terms on our forms and surveys?
Well, what I will point to is the resource that the Ontario Anti-Racism Secretariat has developed, a really comprehensive guidance document on how to even integrate race into survey and data collection. So between the standard that they have developed and between the supplement that CIHI, the Canadian Institute of Health Information, has developed, it clearly spells out not just race and ethnicity, but also indigeneity, and how you can go about thinking about those, and provides concrete examples.
Great, thank you for that. Go ahead.
Ifrah, can you say that again? The Ontario Secretariat of.
I can put it in the chat.
Okay, that would be great.
The other thing that I guess I just want to acknowledge that this topic, there's much for us to think about around it for sure, and I think the encouragement, I guess, is that we sort of have these two perspectives, in that since we work so closely with vulnerable families, I think increasing our awareness of the all of the issues that you outlined, and especially the impacts of these inequalities, is really important for us to be serving communities well. But I think also the invitation is to think about where are we perhaps contributing when we think about those levels that you talked about, both maybe missteps on a personal level, but then also our programs and institutions. How are we maybe falling into traps that continue to perpetuate these inequities? And it's a big statement, and there's no sort of easy answers to that. But I guess I just want to acknowledge that that's, I think, where we need to be contemplating and thinking about. And I don't know if you have any response to that in terms of, I mean, we all offer programs on a community level to vulnerable families across Ontario. So thinking, are there maybe particular places where it might be best for us to start thinking about where our policies or our programmings might be supporting continuing racist policies? I don't know if that question made sense, but if you can pull something out of that.
May I weigh in?
Please. Who's speaking?
Sharn from the 519.
Hi there.
Hi there. My thoughts, thank you so much for providing this platform for us to come together and learn about what PCH has put together. The thought that comes to my mind is we've done a lot of research. There's been research done, and there has been policies put into place in the past and policies that will be put into place in the future. One of the things that would help with folks literally working with families, not folks making the policies and not folks at the board level or at the manager's level, but folks actually working with families, is that the people at the board level and the manager's level preach what they live, what they preach. The policies that you put in place, you need to actually follow them yourself. You need to show your workers, your staff, your employees that this is near and dear to your heart. This is important to you, because if it's not, it's going to trickle down that it's not important to the people who are actually doing the work. So when we read these these stats, when we read these reports, these are great tools to help us write grants to get the funding that's needed to do the work. But it's also a great opportunity to not repeat sameness in terms of who are we bringing to the table to do the work? Who are we bringing into our boards? We need to be aware of that. And we need to challenge the norm. I know that's a lot to ask, especially for folks. This work that we're doing is typically done by women. So challenging the status quo could mean job insecurity, we don't know. But if this challenge is being done by management, if it's being done by the board, and we're making lasting change, not change for 5 minutes because it's trendy, but lasting change, I think that would be something effective across the board. Thank you.
Thank you.
Maybe I could just respond to that a little bit. It's a really, really critical point. Like, we have years and years of research. I mean, not maybe particularly to a population, but we, and you through your work in community, are intimately aware of how discrimination and inequity play out in people's lives. Some of the things that, you know, maybe like at least internally within the federal government are starting to do is look at hiring practices. So even something, you know, how are people hired? Can there be ways in which candidates can apply without including their names? Because it's been documented that, you know, if you have a white sounding name, you're more likely to get a call back than if you have a name that sounds like it's from a different country. So there's kind of tangible things that we can do, but you need recognition and agreement from higher level people in power, basically. So yeah, challenging norms, challenging the way things are done, who is being hired on the board, whose perspectives are being listened to. All of these things are things that we can kind of hopefully tangibly work on.
And I'll just build on that point, Dolon, from sort of a program perspective. One of the things that we are what we are documenting through MHBC is how challenging it is to actually do equity informed work in administering our program. So some of the internal structures that we come up against is things like procurement. So when we want to contract for the evidence review work that we do and other work that we do, when we want to contract researchers, experts from that particular community, and it relates to both Black Canadians, but also LGBTQ Canadians, people with disabilities. We want to hear from the people that are embedded in these communities, that have long-standing roots in these communities, that may themselves be representatives of those communities. We then come up against these structures that aren't designed to do that. So we have these sort of rosters that we have to pick from, and we can't go out and contract out the people that are actual experts. So that's some of the internal barriers. And I just wanted to build off of that point too, to say there's policy action, but then there's also structural changes that need to take place. So Dolon, you mentioned the hiring. I discussed the procurement, but also it's about leadership and investment. We have to invest in order to make these changes sustainable long term. So and even in the leadership position, like to have more people who are decision makers in these processes. So hiring more program managers, for instance, that represent these communities.
Right.
These are all chains of changing the structure from within. And then I think the last point that I would say is being explicit. So there's been a lot of statements over the last year, especially in the sort of racial awakening that has taken place in North America and across the world. But we need to be explicit in what we're talking about. So in MHBC, we explicitly call it anti-Black racism. We're not calling it racism, or we're not calling it discrimination or stigma. We're calling it exactly what it actually is, and kind of leading programming from that perspective.
Thank you.
And that is quite new. Like we've, this is, as Ifrah mentioned, the racial awakening that's taken place over the past year. All of these things were really unspoken up until very recently. So naming and not shying away from the language of what is actually happening is really critical.
Absolutely, absolutely. Is there anybody else who has a question or a comment for our presenters today?
Hi, Sydney and Dolon, Ifrah. It's Blanca.
Hello.
Thank you
Hi,
so much
Blanca.
for coming on with this great presentation. I wanted to just, maybe it's a comment, a reflection, I'm not sure. For many, well, all of our funded projects work with, many will be working with Black Canadians. And a lot of the role sometimes becomes one of advocacy for families, whether it's at school, whether it's with, child welfare, so many areas. So, that is a heavy, it can be a very heavy role. And, there's so much out there to prepare ourselves to do that. But it is challenging. You have to challenge different systems, and even within your own organization, even, sometimes, if you're a member of that community. So any words of, I don't know, any promising practices out there to support, staff in that advocacy role that you could share?
I guess I'll give another example just from the program. There isn't a sort of a uniform guidance best practices document. I guess I can just refer to some of the actions that we're taking within our program. And it is true that as we go about the daily administering of our program through funded projects, so even in our review proposal, our review process for proposals, and when we're asked to review proposals in other Gs and Cs, what we try to do is to kind of lead with these same principles that are leading MHBC. So being very explicit, being explaining what equity informed means, and it is a challenging task to continuously advocate, but I think it's the function that we have to take on, right? So I don't know if that's necessarily, it's not a helpful, it's not a succinct guidance or best practice, but it's sort of just leading through practice, doing it every day, doing it wherever you can, and being, very forthright about like where the inconsistencies are and documenting those inconsistencies.
Thank you. I did also want to mention, I guess part of the silver lining of the pandemic and the crisis that, around racial issues is that we are being held accountable more and more. We have more information, more resources are being offered. So I will post stuff on a couple of resources, and I see Dolon, you've done some too, thank you. That organization 3, which is the early years organization in the United States, have been offering related to developmental, I guess the focus on the developmental stages where children become aware of racism. And it is much earlier than we would think. Between the ages of 2 and 4, children can see racial bias, feel racial bias, and the detrimental impact that has in their learning and engaging moving forward in different systems that they have to be, whether it's childcare at school, even within their own community and among their own peers. So I'll post some resources. There's been some really great webinars as well from another organization called Enjoy, which is a health education. and that's more related to healthcare and the impact of racism. I know that many of us in work with in the area of prenatal health, we are aware of the health violence that many women face when they go into labor and delivery, whether you name it, so many hospitals, so many experiences of women facing this at such a critical time in their lives. People of color, women of color, as well as Indigenous women. So all the resources that come, I would really encourage people to, whenever you have some time, to access those. And there's really great information in both areas, but it can be a lot of information overload. I also understand that, but it is a critical time. I think it's a historical time that we're finally able to talk about these issues and be able to support our parents, families in a better way. So I'll post some stuff on this.
Thank you, Blanca. I see we're getting on to our time here. And I just wanted to check in really quickly with our presenters to see if there are any sort of final thoughts that you'd like to share before we sign off for the afternoon.
I actually, Sydney, wanted to mention something. Your question was related to the collection of this data. And, as Ifrah mentioned, CIHI has proposed this standard, and they're actually doing consultations on their proposed standards. Blanca and I had talked before about possibly organizing a webinar with them. Would that be of interest to this group? Because they are soliciting feedback from multiple organizations on how they're proposing the standard or whether it's inclusive or makes sense. I know they're consulting with academic institutions and national organizations, but it might be helpful to, if that's of interest here, we could talk about it further. But
I think we should talk about it further. I think there very well could be. I know that we're doing a lot of work and thinking about our sort of evaluation processes, and this would be a good time, and it's important to bring this lens to it. Thank you. Thank you. And Ifrah, anything from you? Last thoughts?
No, I just wanted to say that I think Blanca, who had mentioned it, that we are, the positive in the space that we're in right now is that many institutions, almost all major institutions in Canada have made explicit statements sort of denouncing, racism at large, but anti-Black racism in the context of the last year. So now we have explicit language and something that we can reference in the years to come if this does happen to be a moment in time that sort of shifts priorities, shift dramatically to something else. There's a point to recall back to say, but this is what you said and this is what you promised. So what are we actually doing about it? So I think that is, a major leap forward.
Absolutely, absolutely. And again, so much gratitude to the both of you for sharing this with us and sort of helping us along in our thinking and our awareness and our understanding. Really very much appreciated and your time. So thank you, Dolon and Ifrah. And thank you to all of you who joined us this afternoon. It was great to spend time with you, if at least virtually. And I want to point out that I had put an evaluation link, just a short form in the chat for today's session. And if you're able to fill that out, that would be much appreciated. Help us, guide us in the offerings that we have here with our network. So with that, I want to wish you all a wonderful rest of the day and a wonderful rest of the week. And Dolon and Ifrah, hopefully we will remain in contact in some way and follow up about around this idea of evaluation or research. And we will see you again. So thank you and farewell.
Thank you. Thank you
Great,
so much.
thank you. Thanks for having us.
Yes, thank you. Bye-bye.
Take care, everybody.
Bye.
Thank you guys, Dolon, Ifrah, Sydney. Bye.
Bye.